Thank you and welcome to the Aurora Blueprint, our podcast designed for patients who are undertaking the journey towards bariatric surgery. I'm Ruth Blackham, bariatric surgeon, and I'm very grateful to be joined today by Dr. Eman Al-Naggar, who is a consultant obstetrician and gynaecologist who works at her health clinic in Murdoch. Eman, thank you for joining me today.
Thank you for inviting me, Ruth. It's lovely to be with you here today.
Thank you. Now, to start off with, can you tell me a bit about your journey to becoming an obstetrician? What's involved in that process?
So my journey is a little bit different to other people's because I came from overseas. So I did my medical degree in Alexandria University in Egypt, where after that I ended up in Doha, where I started my training. So competitive start at high school, try to do, get the best grades and get filtered and then get into medical school. Then another exam, another interview back in the day where, the first question that got asked was, are you planning to have children? Which is luckily no longer the case. And long 6 years of training just before I became a senior registrar, which is when you are an independent yet still under training. I came to Australia. I moved to New South Wales, where I did my senior registrar training years in northern New South Wales. Lots of fun there, lots of surgical training, which was the biggest thing I trained for in northern New South Wales. Worked at Lismore-based hospital as a specialist for a few years and then moved to Perth to be closer to family and travel. And here I am owning my own clinic, which is great.
So today I wanted to talk about PCOS, fertility and bariatric surgery. So to start off with, could you tell me a bit about PCOS and fertility? Why do women struggle with fertility when they have PCOS?
PCOS is short for polycystic ovarian syndrome. So as the name suggests, it's a syndrome which affects your ovaries and it's mostly genetic. There are lots of little cysts. Now, every time you ovulate, your brain recruits an egg. And when it recruits the egg and it grows to the correct size, then you ovulate. When you have polycystic ovarian syndrome, your ovaries don't just recruit one egg, they recruit lots of different eggs, and your ovary has lots of different eggs, so no one egg makes it to the ovulation stage. And here's where women struggle with their fertility. Some women have polycystic ovaries without actually the syndrome, where they have just the ovary that looks like polycystic, but it works fine. And that's why for women to have fertility affected, it has to be an issue where it doesn't ovulate. Women who have polycystic ovarian syndrome, they have higher levels of a different type of estrogen, which comes from the subcutaneous fat, which also suppresses their ovulation. So here we are in a vicious circle where they're born with this polycystic ovary that doesn't ovulate, and then they have their subcutaneous fat secreting other types of estrogen, and then it doesn't ovulate, and then they have insulin resistance, which is a syndrome in itself. And here we are stuck. We can't lose weight, we can't ovulate, and fertility is affected. Now, there's different types of polycystic ovarian syndrome, which is, we define them medically as thin and overweight, and each one of them needs different kinds of treatment. But obviously in the context of bariatric surgery, women who are overweight with polycystic ovarian syndrome struggle to lose weight in the conventional way.
Where does bariatric surgery fit in the fertility journey for patients who do have PCOS?
That's a very important question. Weight loss has been proven to help women who have insulin resistance and polycystic ovarian syndrome ovulate. If they can't lose weight conventionally, weight loss surgery is a very, very helpful tool. It's really complex because also IVF treatment has a cutoff for BMI. So you will find women who are trying to fall pregnant and are on the bigger side cannot have IVF treatment because of the risks associated with the injections and ovaries becoming overstimulated. So lots of research has been done, and it's proven to show that once women have lost that weight through weight loss surgery, they spontaneously ovulate. Not always, but most of the times.
And a lot of women will ask, is surgery the cure? Is weight loss alone enough? or might they need something else to help with their fertility?
So if we're talking about polycystic ovaries in themselves, most of the times it's very helpful, and then women find that they do not need to go through the fertility journey. If there are other compounding factors, that's a different story. They may still need support or help, but most women just have their periods come back and they have regular cycles and they're ovulating, and some women are just amazed at how quickly they're fertile straight after surgery.
Yeah, okay. And is there an ideal time frame or ideal period between bariatric surgery and trying to get pregnant or trying to conceive?
We can say 12 months is the ideal time frame, 12 to 18 months, but I think, as you would know better than I do, the most important thing is weight stability, that we're not losing weight at a rapid speed where you're struggling to eat or to just maintain your normal nutrition.
Yeah, okay. And are there any risks with rapid weight loss and fertility treatment?
Fertility treatment, I don't think anyone would start fertility treatment if someone's undergoing rapid weight loss. All fertility specialists will ask you to wait for a little while, just until you're stable. Now, weight loss and pregnancy is the issue. So generally when I see a person who's had weight loss surgery, whenever, my first question is, how are you eating? Are you eating okay? Do you feel tired? Do you have iron deficiency? And that's what I look at when I first get a referral for a pregnant woman who's had weight loss surgery, which is a lot. And the type of weight loss surgery they've had and whether they're needing supplements. And the important thing for pregnant women is iron, vitamin D, and vitamin B12. Now, I don't, and as you know, we've had these discussions before, Ruth, about, you know, when women are pregnant after weight loss surgery and you know, have a chat, and we're trying to do what's best for them, involving a physician to check that their vitamin B12 levels are normal, because that can also cause iron deficiency. And the type of weight loss surgery they've had, sometimes they haven't had just a sleeve, which is a restrictive, and they have absorption issues, then it's a different conversation. So engaging early, and lots of all GPs now are well aware of, you know, what can happen with weight loss surgery for women's nutrition, and they're running these tests early. And it's wonderful to have that collaboration with weight loss surgeon, the GP, a physician, and myself. And, you know, you get CC'd on all these bloods and they flash up on your computer and you're like, great, she's doing wonderful. I don't have to worry about it. So now with all these collaborations happening, I rarely have to do any work. Everyone's already well taken care of. So.
Yeah. And as I understand it, if a woman's got PCOS, you often have very irregular cycles as well. And after rapid weight loss from bariatric surgery, they find their cycles are suddenly normalised for the first time either in their life or for many years. And so one of the big questions they ask is, does that mean they would definitely get pregnant, or what might happen in their fertility journey once their cycles are more regular?
So if they're seeking fertility, they probably will fall pregnant. So contraception is the way if they don't want to have a baby. So once we have regular periods, we're sure that women are ovulating. So if they're seeking fertility, give it a shot. If they're not, contraception is the way to go. Will they definitely fall pregnant? No, not necessarily. So many factors: the quality of the egg, you know, the tubes, whether the partner's got healthy sperm. All these questions are important to tackle.
Well, thank you for going through so much of that as an overview of PCOS, fertility and bariatric surgery. It's a question that comes up all the time in my practice. It's so common to the patients I see who are living in a larger body, and clearly a specialist interest of yours as well. So thank you very much for your time, Dr. Eman.
Thank you.